Just give me a 1 moment. Starts recording. Thank
Okay.
you.
Hello. Good evening, everyone. I'm Linda Zheng, from Greenwood International Business School. Today, we are going to explore a common issue, kidney stones. Think of them as tiny hard deposits that form inside your kidneys, almost like little rocks. They might start small, but they can cause significant discomfort and health challenge. So, what exactly are these little rocks? How do they develop? And what can we do about them? In this presentation, we will break down the science behind kidney stones, discuss their symptoms, and share practical tips for prevention and treatment. Let's dive in and uncover the mystery together. Now, to understand how kidney stones cause trouble, let's first take a quick look at the kidney structure. Your kidneys are made up of two main parts, the renal parenchyma, which filters your blood, and the collecting system, which channels urine out of your body. This system includes the minor and major cases, the renal pelvis, and the ureter. When stones form, they often travel through this pathway and tend to get stuck at three narrow points: where the kidney meets the ureter, where the ureter crosses over the iliac blood vessel, and where it enters the bladder. These blockages are what lead to the pain and complications many people experience. But why do stones often start in the collecting system, not just get stuck there? The answer lies in how urine is produced and collected. Deep inside the kidney, tiny units called nephrons filter waste and water from your blood to make urine. This urine then drips into the minor calyces. Think of these as small cup-like collectors. Now imagine these minor calyces as several small funnels merging into a few larger ones called the major calyces. The major calyces then all drain into one large funnel-shaped chamber, the renal pelvis, which is the gateway to the ureter. So, why are these areas a perfect breeding ground for stones? Concentration zone. This is where all the microscopic waste crystals from the entire kidney converge and become concentrated. If your urine is saturated with minerals like calcium or oxalate, this is where they begin to meet and clump together, forming the initial nucleus of a stone. Relative stagnation although urine is always flowing, its movement in large chambers like the renal pelvis is slower and less turbulent than in the narrow ureter. This gives tiny crystals more time to sit and bond with each other, much like how snowflakes dig together in calm air to form a snowball, rather than being flushed down a fast-moving stream. Anatomical nukes, the intricate shape of the calyces, especially where they join, can create tiny areas of slower flow. These little quiet corners provide a perfect sheltered spot for a small crystal to settle and start growing, undisturbed by the main flow of urine. So, how do you know if you might have a kidney stone? The most common and dramatic symptom is intense pain, often called renal colic. This pain usually starts suddenly in your back or side and can radiate down to your lower abdomen and groin. Alongside this, you might notice blood in your urine, sometimes visible, other times only under a microscope. Nausea and vomiting are also common due to the severity of the pain. Additionally, some people experience urinary symptoms like frequent urge to urinate or a burning sensation when they do. It's worth nothing, though, that not everyone with kidney stones has symptoms. Some stones are silent and go unnoticed until detected incidentally. Not all kidney stones are the same. In fact, they come in several types, each with different causes and characteristics. The most common, about 80% of cases, are calcium oxalate stones, which form when calcium combines with oxalate in the urine. Next, we have calcium phosphate stones, often linked to certain metabolic conditions. Uric acid stones can develop in people who consume high purine diets or don't drink enough fluid. Then there are infection-related stones, which form in alkaline urine and can grow quickly. Finally, cysteine stones, though rare, are caused by a genetic disorder that leads to excessive cysteine in the urine. Knowing your stone type is crucial for effective prevention. You might be wondering, what leads to the formation of these stones? One of the biggest factors is inadequate hydration. When you don't drink enough water, your urine becomes concentrated, creating an ideal environment for crystals to form. Diet also plays a key role. Foods high in oxalates, sodium, animal protein, or purines can increase your risk. Beyond lifestyle, medical conditions like hyperparathyroidism or recurrent urinary tract infections can contribute. Genetics can also predispose someone to stones, as can conditions like obesity and diabetes. If you suspect you have a kidney stone, how is it diagnosed? Imaging tests are the gold standard. A CT scan is highly accurate and can detect even small stones. Ultrasound is another option, especially for pregnant women or as an initial screening tool, though it may miss stones in the lower ureter. X-rays can identify many stones, but aren't as reliable for detecting radiolucent ones, like uric acid stones. In addition to imaging, lab tests are essential. A urine analysis can reveal blood, signs of infection, or crystals, while blood tests help assess kidney function and check for underlying metabolic issues. For smaller stones, typically those under 6 milliliters. The goal is often to help them pass naturally. The simplest and most important step is to drink plenty of water. Aim for at least 2 to 3 liters a day to encourage steady urine flow and help push the stone along. Physical activity, such as walking or light jumping, can also aid to process. In some cases, your doctor may prescribe medications like alpha blockers, which relax the muscles in the ureter, making it easier for the stone to pass. Pain management is another key aspect, as the journey can be uncomfortable. Remember, this approach is generally suitable only for smaller stones. Larger ones may need more intervention. What happens when a stone is too large to pass on its own? In such cases, medical procedures become necessary. One common non-invasive option is extracorporeal shock wave lithotripsy, or ESWL. This treatment uses sound waves to break the stone into smaller fragments that can then be passed more easily. For stones that are harder to reach or too large for ESWL, minimally invasive surgeries like ureteroscopy may be used. This involves inserting a thin scope through the urethra to locate and laser the stone. For even larger or more complex stones, percutaneous nephrostomy, or PCNL, is performed through a small incision in the back. These methods are highly effective and have helped countless people find relief. When it comes to kidney stones, prevention is always better than cure, and the single most effective preventive measure is staying well hydrated. Why? Because water dilutes the substances in urine that form stones. I recommend aiming for about 2 to 2.5 liters of urine output per day, which usually means drinking 8 to 10 glasses of water. Don't wait until you are thirsty. Make a habit of sipping water throughout the day. A simple way to check your hydration status is to look at the color of your urine. Pale yellow or clear means you are on the right track. Along with hydration, dietary change can make a big difference, especially tailored to the type of stone you are prone to. If you have had calcium oxalate stones, try letting high oxalate foods like spinach, nuts, and tea. Boiling vegetables can help reduce their oxalate content. And don't cut out calcium entirely. Getting enough dietary calcium actually helps bind oxalate in the gut. For those with uric acid stones, reducing high purine foods such as red meat, organ meat, and beer is important. Instead, load up on fruits and vegetables, which can help make your urine less acidic and reduce the risk of stone formation. No matter what type of kidney stone you are dealing with, some general rules apply to everyone. First, watch your sodium intake, as high salt levels can increase calcium in the urine. Second, moderate your animal protein consumption, which can raise uric acid and calcium excretion, including citrus fruits like lemons and oranges in your diet is beneficial. They are rich in citrate, a natural inhibitor of stone formation. Maintaining a healthy weight through balanced eating and regular exercise also lowers your risk. And if you have had stones before, don't skip those follow-up visits with your doctor to keep everything in check. Now, let's talk about how certain products like Greenwood blueberry juice can support kidney health. First, it's a great source of hydration, which we know is crucial for diluting stone-forming minerals in urine. It also contains natural citrate, a compound that helps prevent crystals from clumping together to form stones. What's more, blueberries are naturally low in oxalate, so you won't be adding to the problem. And let's not forget the antioxidants. They help protect your kidneys from oxidative stress and support overall urinary tract health. It's a tasty and practical addition to a kidney-friendly lifestyle. Another helpful supplement is Greenwell's chitosan capsule. Its main action takes place in your digestive system, where it binds to dietary oxalate. Think of it like a sponge soaking up oxalate from the food you have eaten, preventing it from being absorbed into your bloodstream. But that's not all. Catechism acts as a prebiotic, supporting the growth of beneficial gut bacteria. Some of these good bacteria, such as uh, Oxalobacter formiginans, lactobacillus, and bifidobacterium, are known to break down oxalate. By enhancing this natural process, Catechism offers a twofold defense against kidney stones. Okay, as we wrap up, I want to leave you with this key takeaway. Kidney stones may be common, but they are also largely preventable by understanding how they form, recognizing the symptoms, and adopting healthy habits like drinking enough water, eating wisely, and considering supportive supplements. You can significantly reduce your risk. Let's aim for a lifestyle that keeps those little rocks from becoming a big problem. Thank you for your attention, and I wish you all healthy living, free from kidney stone worries. Okay, thank you.
Thank you, Miss Linda Zheng. Thank you for these wonderful presentations about the kidney stone. So now we understand, how to prevent these health problems with Greenwood products. Next, please, let's welcome Madam Michelle Fagella to present us about the Alzheimer's disease, one of the very common degenerative cognitive problem. Thank you.
Thank you, Mom Rain.
It will take a little bit while.
Thank you. So, hello everyone. I am Michelle Kiovahela, and today
Sorry,
we're
Michelle.
going to.
Sorry, Michelle, too. Sorry for Rep so, sorry for interrupting you. The file is not open. Maybe
Oh,
because of the internet connection. So, you can do it again.
okay, memory. Thank you.
We still see the folder.
Oh, I see.
Yes, you can open it.
Okay, thank you. Okay,
Not yet,
so
still.
it's ready.
No,
Oh,
still not yet. Maybe it take a while. Uh, or what you can do is you can stop sharing the screen and start sharing your screen again.
okay. Thank you so much. Um,
Yeah, now we can see
it's
it. Thank you.
okay. Thank you so much. So, hello everyone. I am Michelle Giovahela, and today we're going to spend some time discussing a condition that is deeply connected to our most personal selves, our brains, and our memories. I'm talking about Alzheimer's disease. Many of us have experienced moments of forgetfulness, like misplacing keys. But Alzheimer's is different. It's not a normal part of aging. It's a progressive disease, a gradual unrevealing of memory, thinking, and the very skills that make us who we are. By understanding what it is, we can better face it, work to prevent it, and contribute to the path that may one day lead to a cure. So, what exactly is Alzheimer's? It's a crucial to understand that it's more than simple forgetfulness. First and foremost, it's a progressive and irreversible neurodegenerative disorder. Progressive means it gets worse over time, and neurodegenerative means it involves the gradual breakdown and death of nerve cells in the brain. This makes it the most common cause of dementia, accounting for 60 to 80% of all cases. It's also vital to know that this is not a normal part of aging. While age is a risk factor, Alzheimer's is a distinct disease of the brain. So, what does this disease look like physically? It's characterized by massive brain cell death, which leads to the brain actually shrinking in size, a process we call brain atrophy. And this results in a devastating loss of function. This physical damage is a what leads to the symptoms we all recognize. To understand the scale of the challenge, let's look at some numbers. According to the World Health Organization, in 2021, approximately 57 million people are living with dementia globally. Think about that number. It's larger than the population of many countries. Of all those cases, Alzheimer's disease is responsible for 60 to 70% of them, but the impact goes beyond just a diagnosis. This disease is a leading cause of disability and dependency among older adults. It robs people of their ability to perform simple daily tasks, often requiring round-the-clock care. And tragically, it's also one of the top causes of death in the elderly. So, what are the specific challenges these symptoms create? The symptoms of Alzheimer's are multifaceted and go far beyond memory loss. Of course, memory loss is a cure picture, particularly forgetting recently learned information. But patients also experience what doctors call the three A's. First, aphasia, which is the inability to find the right words or understand language. And second, apraxia, which is the inability to perform familiar motor tasks like buttoning a shirt. And thirdly, agnosia, which is the failure to recognize objects or even people. And there's also facial impairment, which can cause someone to get lost in a familiar neighborhood. So perhaps some of the most heartbreaking symptoms are the personality and behavioral changes. A once gentle person may become anxious, depressed, or easily irritated. So, what's actually happening inside the brain to cause all of this? Let's take a closer look to inside the brain of a person with Alzheimer's. There's two key pathological processes are at work. Think of them as the hallmarks of the disease. The first is the formation of beta amyloid plaques. Imagine this as a kind of sticky, toxic debris that builds up in spaces between nerve cells. This skunk interferes with cell-to-cell communication, like static on a telephone line. The second is tau tangles. Inside the cell, tau proteins, which normally act like a railroad tracks, transporting systems pulls apart. And the nerve cells starve and die. The final outcome of this dual attack is severe shrinkage or atrophy, particularly in critical areas like the cortex for thinking and the hippocampus for memory. This physically disrupts the entire brain network. Now, research is evolving, and there are some new ways of thinking about these processes, which we'll explore next. For a long time, we thought of beta amyloid as simply as billion, but a new, more nuanced view is emerging. Some researchers like Dr. Dale Bredesen proposed that beta amyloid might actually have a protective role. In this view, the brain produces amyloid as a protective response to three major threats: inflammation in the body, and lack of key nutrients, and exposure to environmental toxins. The problem isn't the amyloid itself, but the fact that the brain is constantly being overwhelmed, leading to unhealthy and chronic overproduction. Building on this concept, Dr. Bredesen developed the RECODE protocol. The goal is this personalized protocol isn't to just attack amyloid, but to identify and address the root causes driving its production. So, what are these root causes? Dr. Bredesen has categorized them into three main subtypes. Dr. Bredesen's framework helps us think about Alzheimer's not as one single disease, but as falling into three main categories. True, most patients are a mixed. The first is the inflammatory type, which is driven by chronic inflammation throughout the body that ends up attacking brain cells. And the second is the atrophic type, where the brain literally waters away because it lacks the supportive nutrients, hormones, and other molecules it needs to thrive. It's a problem of brain malnutrition. The third is a toxic type driven by exposure to various environmental toxins like mold, heavy metals, or biotoxins. Understanding that there can be different drivers helps explain why a one size fits all treatment doesn't work, as these different processes damage the brain and disease manifests in a predictable progression through stages. The journey of Alzheimer's typically unfolds in three broad stages. In the early or mild stage, the most noticeable sign is recent memory loss, along with emerging anxiety and difficulty learning new things. As it moves to the middle or moderate stage, memory worsens significantly. People may become disoriented, have impaired reasoning, making them susceptible to scams, and show clear problems with language and motor skills. In the late or severe stage, individuals lose the ability to care themselves, may not recognize their own family, and experience severe physical decline. It's important to know that Alzheimer's is just one type of dementia, and it's often helpful to distinguish it from others. So, how is Alzheimer's different from other forms of dementia? Let's do a quick comparison. Vascular dementia is often caused by strokes, so it tends to have a sudden onset, whereas Alzheimer's has a slow, insidious, progressive onset, and Lewy body dementia often involves severe fluctuations in alertness and visual hallucinations, which are less common in Alzheimer's. And frontotemporal dementia typically present with very early and dramatic personality changes and loss of social inhibition, while Alzheimer's, these personality changes usually happen later. Finally, Parkinson's disease dementia often shows prominent executive dysfunction, trouble with planning and organizing, while memory impairment is more prominent in Alzheimer's. Now that we understand the types and progression, what puts someone at risk for developing the disease in the first place? The risk factors for Alzheimer's fall into two buckets: those we can't change and those we can. On the non-modifiable side, the biggest risk is age. After 65, the risk roughly doubles every 5 years. Family history and genetics, like carrying the APOE4 gene, also play a role. But here's the hopeful part: the modifiable factors, which are our focus for intervention. Cardiovascular health is critical. What's bad for your heart is bad for your brain. This includes hypertension, diabetes, and obesity. Then there's a lifestyle: physical inactivity, smoking, and poor diet. Finally, cognitive and social factors like low education and social isolation can increase risk. So, treatment for Alzheimer's is a two-pronged approach, combining medication and lifestyle intervention. On the pharmacological side, we have drugs like cholinesterase inhibitors, including donepezil and galantamine, which can help improve symptoms in mild to moderate cases by boosting brain chemicals involved in memory. But for moderate to severe cases, we have NMDA receptors antagonists like memantine, which help regulate another brain chemical. It's important to remember these drugs manage symptoms, but do not stop the disease progression. That's why non-pharmacological side is so vital. This includes cognitive stimulation to keep the brain active, physical exercise to improve blood flow, and behavioral management strategies to help cope with challenges like anxiety or agitation. A major part of non-drug treatment is focused on prevention, which is our next topic. While we can't change our genes or our age, we have significant control over many risk factors. Prevention starts with a brain healthy lifestyle. First, manage your health. Work with your doctor to control hypertension, diabetes, and high cholesterol. Second, exercise regularly. A mix of cardio and strength training gets blood pumping to the brain. Third, stimulate your brain constantly, like reading, learn new skills, play puzzles, or musical instrument. Fourth, adopt a healthy diet, a Mediterranean style diet rich in fruits, vegetables, and good fats, provides powerful antioxidants. And fifth, stay socially active, maintaining a strong social connections, fights insulation, and keeps your mind engaged. This concept of supporting brain health through nutrition leads us to look at some specific supplements that may offer benefits. You can choose Green World Deep Sea Fish Oil. It's rich in omega-3 fatty acids, especially DHA and EPA. DHA is fundamental building block of the brain, crucial for its structure and function. Meanwhile, EPA is known for its powerful ability to reduce inflammation throughout the body and brain. Since we know inflammation is one of key drivers of the disease, especially in the inflammatory subtypes, incorporating anti-inflammatory elements like fish oil can be a supportive strategy. Another category of powerful anti-inflammatory nutrients comes from deeply colored nutrients and fruits. So, products like blueberry super nutrition powder and blueberry juice are loaded with compounds that support the brain. Blueberry super nutrition powder is rich in phospholipids, proteins, minerals, and most importantly, anthocyanins, the pigments that give blueberries their deep color. Blueberry juice often blends various berries and grapes, making it a concentrated source of antioxidants. The key benefit here is that research suggests these anthocyanins have a unique ability to cross the blood-brain barrier, that protective shield around the brain. This means they can deliver their antioxidants and anti-inflammatory benefits directly to the brain cells that need them. And another superfood that delivers a concentrated dose of brain-supporting nutrients is spirulina. Spirulina is a blue-green algae that is considered a nutrient-dense superfood. It's loaded with protein, B vitamins, iron, copper, and other essential minerals. For the brain, it provides a wide spectrum of nutrients that act as a cofactors for countless biochemical reactions. By helping to ensure the brain has the raw materials it needs, spirulina may play a role in helping to reduce cognitive decline, particularly by addressing the nutrient deficiencies seen in a tropic subtype we discussed earlier. And Ginkgo biloba is one of the oldest living tree species, and its tract has been used for centuries. It contains active plant compounds that are believed to support cognitive function in a couple of key ways. Primarily, it's known to support brain microcirculation, that is improving blood flow in the smallest vessel of the brain. Better blood flow means more oxygen and nutrients are delivered to the brain cells. In conclusion, Alzheimer's is a complex and challenging disease, but we are not powerless against it. Through greater understanding, proactive lifestyle choices, and comprehensive management strategies, we can work towards preserving our cognitive health as long as possible. Thank you for your time and attention. If you have any question, you're free to ask.
Thank you very much. Thank you. Thank you, Madam Michelle, for this wonderful presentation about Alzheimer's disease. So we can see that we have one questions in our chat box asking about the kidney problems. What is the nephronic syndrome? If you have any questions, you can text in the chat box, or you can simply raise your hand after I answer the questions about the nephronic syndrome. Well, this is a very good question. Nephronic syndrome, when we talk about syndrome, it means this is a series, a group of signs and symptoms, not a single one. This is very common problems after somebody suffered from kidney diseases for a while. So first of all, nephronic syndrome is a kidney disorder characterized by a collection of symptoms that indicate the damage to the tiny filtering units of the kidneys called glomeruli. It is not a single disease itself, but a set of signs that appear. So there are several diseases that can cause these symptoms, the nephronic syndrome. So they're primary and they're secondary. For primary diseases, normally it occurs during the childhood, um, you know, but what very common to us are the secondary diseases, which means that diabetes, the most common diseases that can cause the damage of the filtering units of the kidneys, including long-term and controlled high blood pressure and long-term and controlled high blood sugar, which means diabetes, either diabetic type 1 or type 2. Both of them can cause the same problem if you don't control the diabetic. Okay, so this is the very common disease. And also autoimmune disease like lupus. I think, we talk about lupus many times. So autoimmune disease can also cause the damage of the filtering unit of the kidney. And also infections, especially viral infections, hepatitis B, hepatitis C, HIV, malaria, and also recently, we know more about the COVID. So we know that COVID actually can cause the multiple damage of the organs. So it is not only for respiratory disease, but also after we suffer from COVID, especially for those people whose immune system overreact to the virus, that can eventually cause the damage of the lungs, the heart, the kidneys, and sometimes even the liver and the brain. So all this can cause, the nephrotic syndromes. So the typical signs of this syndrome is when you press, the skin, actually, it leaves a dent when pressed, especially in the legs and around the eyes. So we can see the swollen eyes upon getting up. And also after we urinate, we see the foams, a lot of foams formed in the toilet bowl. So foamy and frothy urine due to high protein because the albumin protein leak through the filtering unit of the kidneys. They cannot be reabsorbed into of bloodstream, and definitely fatigue and lack of energy. And due to the water retention, that we suffer from weight gain and loss of appetite. So to diagnose this is very simple. So almost all the kidney diseases, for a proper diagnosis, you go for a blood test and also urine test. So, blood tests can read check the albumin, cholesterol, and kidney function, including creatinine and, the BUN. As for the urine test, you can see that whether there's protein in the urine. So if there protein exists in your urine, it means that the filtering unit of the urine are being damaged. So this is about these questions. So let me see. I know, Mr. Eric Towell, I know your question. I'm going to go to your questions very soon. So let me read this. Can kidney tonify be used in treatment of kidney stones? So actually, it definitely can be used, can be recommended. But for kidney stones, 80% of the kidney stones can be alleviated through adequate, hydration. So, I hope you still remember what Miss Linda Jung has presented to us. Hydration, hydration, drink plenty of fluid, water and herbal teas, not too much coffee, and definitely not the soda drinks, can help almost 80% of the kidney stones. So products are good, but number one, drink plenty of water. Let me see more. Um, Okay, let's talk about Alzheimer's disease later. Now we go to the Alzheimer's disease. Uh, First of all, Mr. Budiman forwarded me a question raised by a trainer from Kenya, Mr. Eric Talvo, about a very interesting questions. Uh, in terms of the relationship between the Alzheimer's and dementia. Is that so, Mr. Eric Tower? Is that your question? Hello, Mr. Eric Tower, are you there? Okay. If you're not there, because I saw you raise your questions. Good
Good
evening. How are
evening.
you? Yeah, how are you, Mr.
I'm
Eric
fine.
Tower? How
I'm
are
good.
you?
I'm good.
Good,
Happy New
good.
Year.
Happy New Year to you and to all
Yes,
the trainers and leaders and distributors in Kenya.
yes. Uh, we are happy now. I have a question
Yes.
about Alzheimer's disease. I
Okay.
wanted to know if there is a relationship between Alzheimer's disease and dementia. If there is
Okay.
a relationship between the two, and if there is can one lead into the other, or what happens? Because I know there kind of affects the brain, or issues to do with the mind.
Thank you very much for your questions. This is a great,
Yes.
great question. Actually, there is definitely a relation between dementia and the Alzheimer's disease. Let us put this way. Dementia is the umbrella term, like, how do I say? Okay, if you understand the relation between heart attack and heart disease, then definitely you understand the relation between Alzheimer's disease and dementia. Okay, heart disease is a broad spectrum of heart disorders, and one of them is the heart attack. So there are many kind of heart diseases like the atherosclerosis, the heart failure, the inflammation of the heart muscles, and also the valve diseases, the diseases of the valves. But one type of heart diseases is the heart attack. So let me put it this way. Alzheimer's disease is the most common cause of dementia. I hope you still remember one slide uh, showed by Miss Michelle about different types of dementia. Number one, vascular dementia. Vascular dementia means that, you suffer from atherosclerosis, especially the blood vessels that supply the blood to your brain. And then because of it narrowed, so less blood supply to the brain. So the neurons, the brain cells are in constant lack of oxygen and blood supply. So due to this, gradually it start losing its functions. So actually, I can share this personally because my mom is suffered from the vascular dementia. Uh, because my mom suffered from different multiple times of uh the how to say uh the stroke, but not major, but the minor ones, but several times. So each time, it makes her brain lack of the blood, the sufficient blood supply. So gradually after years, after 10 years, I observe from actually not necessarily from a memory loss, because all of us believe that the first signs and symptom of dementia is loss of memory. It's not true. It is written in the notebook, but actually in the real world, something really I observed something really, really interesting. That is, she starts suffering from emotional swings. Most of the time she has very quick temper, lose her temper very easily. And then, she was such a kind and good-tempered lady when she was young, I remembered. But when she was old, when she approached 70, 75, she starts become lost her temper easily and get crossed very easily to almost everybody, start complaining constantly. So I can recall this was her first sign. And then later on, we understand that this is part of dementia. Forgetfulness developed later after emotional swings, after emotional change. So, this is kind sort of vascular dementia. And there's a Lewy body dementia that, remember that there's special uh, plaques, like the beta amyloid plaques. How do we understand this? It is a very special uh, protein it's kind of you can think about the kind of calculation of the proteins. It forms some protein, and this kind of protein is so big that it can blocks the micro circulation of your brain. Macro circulation is also as important as the main circulation system of the brain, because the micro circulation directly influence the blood supply and the oxidative stress of your neurons. So if these proteins start forming in your brain, then gradually your brain cells lack of oxygen, and the cells attacked by the free radicals. So this is another issue. And believe me, I read a lot of articles recently. They said that this kind of protein actually doesn't form in the brain. It actually initiatively it forms in the gut, in the intestine, and through there's access between of gut and the brain. Through this gut-brain axis, they traveled through the bloodstream right into the, into our brain. So that is why we said that if you want to have a healthy brain, you need to do at least two things. One is too much of something. What does it mean? Too much toxins. Uh, there are two great type of toxins. One is the heavy metals. Okay, I understand that, in some of the areas in the world of waters and soil are polluted with heavy metals and also, the chemicals, which we can do nothing about that. You can't just move from place where you know that it's polluted. Basically, many places are polluted. You can't move from place to place. But what we can do is detoxify. And there's another heavy metal pollution is caused by the overuse of aluminum utensils. I still remember when I was a kid, we also used aluminum pot, aluminum kettle to boil the water to cook the food. But I think during the 80s of the previous century, 1980s, Chinese people, we started noticing that the aluminum can cause the problem. So we stopped using the aluminum utensils, the cooking utensils. So we shifted to stainless steel. But I noticed because I lived in Africa for almost 20 years, so I understand that still in especially in villages, a lot of people, a lot of ladies, they're still using the aluminum cooking ware to cook the food. So for the sake of health, so let's shift to, let's invest in stainless steel. This can help us to prevent, at least to prevent the aluminum uh, induced dementia. So this is another issue. But for this too much of toxins, what we can do is detoxification. And also another type of toxins is the free radicals. Too many free radicals. Actually, when we understand the status of too many free radicals in our body, it is the oxidative stress. So the best product to counteract the oxidative stress is the blueberry products. Of course, spirulina, any product that contains the any product that contains the antioxidants that are very good products for detoxification. Spirulina is good, blueberries are better. Why? Because blueberry anthocyanins can cross the blood-brain barrier. It is among very rare nutrients that can eventually cross the blood-brain barrier and work directly in our brain. So that is why we said that if you want to detoxify yourself and if you want to protect your neurons, you'd better take any products that contains blueberry. So in Africa, we have a blueberry juice, high VC, blueberry anti-aging, blueberry super nutrition, blueberry coffee, blueberry tea. Nowadays we introduce the blueberry collagen peptide. And also we recently have the blueberry cocoa, blueberry dark chocolate, blueberry candy, uh, even blueberry wine, those products can help. Of course, I don't suggest you drink wine to protect your brain because the alcohol, yes, the blueberry does something good, but alcohol does something, bad. So, let's forget about this blueberry wine. But, all other blueberry products, they can help with these problems. So, Alzheimer's disease is a specific progressive brain disease, and the most common cause of dementia, accounting for 60 to 80% of cases. It is, the Alzheimer's. Not only Alzheimer's, Parkinson's disease also cause dementia eventually. Parkinson's disease at the beginning, you start, observing the problem of the how to say, the movement, the motion. So actually, those people cannot work properly. They work very fast, but with very small space, and they tend to fall. So, and then, tremor. When they hold the spoon, when they hold the chopsticks, you find that, their hands start shaking. So this is the early signs of Parkinson's. But eventually, Parkinson's disease also cause cognitive degeneration, dementia. So another type of remember that slide. Another type of dementia is Parkinson's disease caused dementia. So I hope this can help you to understand the relation between the Alzheimer's diseases and dementia, and Parkinson's disease and dementia. Anyway, whatever we suffer, eventually, if we don't control the progression of the disease, eventually after 5 years, 10 years, they're going to progress into dementia, which is irreversible. So when dementia is on site, nothing can do. There's medicine for Parkinson's. Every month I go to a special hospital, a neurological hospital, to buy the medicines for my dad. My dad has Parkinson's. So there are medicines for Parkinson's, but so far they're not specific medicines for dementia. So we highly rely on the dietary supplements and the change of lifestyle changes like exercise, eating healthy food and rest well. And, the very important dietary supplements like the blueberry products. So I hope, Mr. Eric Tower, that, my answer served you well.
Thanks a lot. Well understood.
Okay, thank you very much. Any more questions? Because also Mr. Budiman sent me another question. Okay, let us see. Madam Crystal, London, I see you raise your hand for a while, so please unmute yourself so we can interact before I answer the questions about the kidney.
Yes, thanks, Madam Renee. This is my daughter phone as well as I'm using
Oh,
it. My name is Zora.
Zora, how are
Yes,
you?
Madam Renee. I'm doing excellent. And how about yourself?
Thank you. Hi, Zora, how are
Happy
you?
New Year. Yes,
Happy New
I'm
Year to
good.
you.
Happy New Year. And thanks to Madam Michelle and Madam Linda for such a beautiful presentation. And because I know other people need to ask questions. My question is, Madam Renee, because I was going to ask you tomorrow. I notice a lot of people having strokes. So what does Alzheimer's disease has to do with the strokes? Is it the same? Because I noticed when Madam Michelle was showing the slide, the things that happen to our brain with the strokes is exactly what I see with the Alzheimer's disease.
Yes, Madam
So
Zora.
yeah,
This is a
so
great
yeah, so all
this
right,
is
go ahead, Madam Renee.
Okay, this is a great question. I said, I can answer these questions with my personal experience. Actually, not me, but my mom. My mom suffered from several times of minor stroke. Not very severe, no paralysis, but she can feel. Sometimes she told us, "Oh, hey, I cannot pronounce clearly. I find that my tongue actually gets stiffened." So so I can see that for several days or for 1 or 2 weeks, she can't speak clearly. Or sometimes she complained that, all of a sudden, I cannot see clearly. Okay, because why? Because, very tiny blood vessels that supply the brain. I'm sorry, you got to really unmute yourself, otherwise. Thank you. Okay, so after suffer from this stroke, either minor or major stroke, that the consequence is the blood supply to your brain is somehow blocked. Not completely blocked. If it is completely blocked, you suffer from severe stroke and you're gonna to die. But part of the blood vessels or the micro, we call it circulation, got blocked. So by with this, that's the neurons suffer from lack of oxygen and lack of nutrients due to the poor blood supply. Yes, if you suffer from this for a long time, for 5 years, for 10 years, then gradually, your neurons are going to die. So actually of neurons, every day, naturally with aging, uh, millions of neurons are dying. Only a few of the neurons can regenerate. So the speed, always the dying neurons overtake the regenerations of the new neurons, the brain cells. So that is why we said that, gradually we start losing of neurons. So then with this poor blood supply, your brain cells die faster and more rapidly. So, if they die, then you develop the signs and symptoms of forgetfulness, the emotional swing, the decline of the cognitive functions, including decision making, including thinking, including any learning. My mom is a doctor. Actually, she's how to say, she's major is in cardiology. But you can imagine now she cannot remember the names of her family member, but she can recognize me and my dad, that's for sure. But if you talk about her friends, colleagues, most of the time she couldn't remember their names. So you can imagine gradually their cognitive functions start decline. And gradually and gradually they're going to lose everything. But fortunately she can eat and she can walk, and she can remember to take her medicine. So definitely stroke can cause Alzheimer's disease and can eventually cause dementia. So this is the relation between stroke and Alzheimer's disease and dementia. I hope
Wow. So,
Madam
Madam
Zora.
Renee,
Yeah,
yes, so thanks, Madam Renee. So, the spirulina, the blueberry, and the deep fish oil is good for the strokes.
definitely.
It's
So
also good for the strokes. All
very
right.
good. Yeah, in Canada you have the omega, the super omega 369, which are good, and
Yes.
also you have the hop oil, very good. Uh, Spirulina is good, and blueberry is super. Why I said blueberry super is because the isocyanates can directly cross the blood-brain barrier and work on your neurons directly.
Beautiful. Thanks, Madam Renee, because I'm treating a gentleman and I notice a lot of people now coming up with strokes in
Yeah,
Canada. So thank you
yeah.
so much.
Thank you, Madam Zora,
Thanks.
and we'll see you tomorrow when we talk
Yes.
about the company, updated company profile. Thank you.
Thank you. Thank you.
And Mr. Solomon, please unmute yourself. We can interact.
Yes, Madam Rain. Good evening
Good
to
evening.
everyone.
How are you?
Yes, I'm fine. I'm fine. I just wanted to know whether this dementia, Alzheimer's disease, and the multiple sclerosis are related.
Oh, this is also another great question. Today I think, at least we have 4 to 5 great questions. First of all, the relation between the Alzheimer's disease and dementia. Now let's talk about multiple sclerosis. Sorry. Okay. Multiple sclerosis, we talk about this disease a lot when we presented the autoimmune disease. The multiple sclerosis actually is one of the autoimmune disease that attack systematic, we call it systemic autoimmune disease. There are different categories of autoimmune disease. Some autoimmune diseases attack specific organs like asthma, attack of lungs and the air pipes. Some attacks the kidney, like some attacks the pancreas, like the type 1 diabetes. Some attacks the kidney. But there are two, okay, the multiple sclerosis actually attacks of neural systems. And which part of the neural systems? The myelin sheath. Okay, let's understand the myelin sheath first. Everybody knows the cord or the wire, electric wire. You understand that inside the electric wire, actually there's a copper. There's a wire, metal copper, mainly compressed of copper, because this is the electric duct that direct the electricity from the main power to your whatever, to your lamp, to your microwave. But to prevent the electric shock, that you must know, you see that there's an insulation outside, there's an out layer of the wire, mainly the plastic, rubber, whatever, anything that cannot conduct the electricity. So it protects the electricity, let the electricity only travels through the metal, not outside. Okay, sorry, Mr. Solomon, I mute yourself and later you can unmute yourself. So of neurons have very similar structure of the wire. Inside the neurons, kind of structure that can conduct the bioelectricity, not electricity current, but bioelectricity. Because actually, of neurons gives off the bioelectric current, and then this bioelectric signals are passed in between the neurons through the special devices, and then to also prevent this bioelectric current to going out. So we have the insulation, and of insulation wrapping the neurons, definitely not plastic or rubber, but that structure is called myelin sheath. It's kind of envelope. So this myelin sheath is mainly consists of the lipid or fat, especially the omega-3. So that is why we know that omega-3 is part of the structure. Lecithin and omega-3 are part of structural component of neuron, of myelin sheath. And this myelin sheath is exposed to the oxygen because of brain use up almost 80% of oxygen that we inhaled. So, the brain consumes a lot of oxygen. So, of neurons are exposed constantly in oxygen. So, oxidative stress is onset. So, if you don't protect of brain or neuron sheath with omega-3 and lecithin, then this is one cause that can cause the problem. And the second is autoimmune disease, that for whatever the reason of brain, myelin sheath are under the attack of own immune system. So actually of immune system has dual roles. Number one, it must identify what are the of own body and what are the enemies. But when of immune system of immunity is imbalance, it acts overactively. So it doesn't recognize, it doesn't, identify who are the enemies and who are the self. So it mistakenly attack the myelin sheath of brain. So, the myelin sheath is damaged, and then, neurons are everywhere in our brain, spinal cord, and then extremities, every part, we have nerve systems. So then of the whole nerve systems under attack of immune system, then this is called the multiple sclerosis. So far, there's not specific medicines that can completely reverse the whole progress. But to protect and slow down the attack is a key. So for this kind of diseases, that you got to recommend the nutrients that can nourish of nerve systems, including omega-3, including the lecithin, the ginkgo biloba. This is important. Also, you have to consider that this is caused by the autoimmune disease. This is because of immune system is working overactively. So we need some immune balancer. I don't call immune booster. Actually, they're immune balancer, like Ganoderma, like cordyceps. So those products, actually, they work as the immune regulator. So they are the immune regulatory products. So you also add those products to help with this disease. So yes, the answer is definitely there are relations between the multiple sclerosis and the Alzheimer's diseases and the dementia. And you have a way to help your customers to deal with this kind of situation. So I hope this answers make you also serves you well, I suppose.
Thank you very much, Madam Rain. I'm answered. Thank you.
Okay, thank you so much, Mr. Solomon. My mom has a stroke 5 years ago. Her left hand is still not functioning. So what can I give? Memory and sight. Okay. Okay, Madam Florence, you can definitely give anti stroke products. We do have products. Sorry. Please.
Unmute me.
Yeah, okay, thank you. So you can give products that nourish the nerve system, like the omega-3 deep sea fish oil, lecithin, spirulina, and also the products works as a blood thinner. We do have products that work as a blood thinner, like the chitosan capsule, also very good. So these products can help to prevent the recurrence of the stroke, because stroke, once it's occurred, if you don't remove the root causes, so for after a period of time, then it could reoccur. So to prevent the reoccurrence of the stroke, you can start taking those products. Does it mean that if a teenager has signs of Parkinson's disease, they're lucky to suffer from dementia? A kid, normally Parkinson's disease actually starts from adulthood or late adulthood, let's say 40, 50. I don't know why a teenager suffer from Parkinson's. Are you sure it is a Parkinson's disease? But if it was true that a teenager suffer from Parkinson's disease, yes, definitely, if you don't control it, at their late adulthood, 40 years or 50 years, they're going to suffer from dementia. But what I know is for young people who has Parkinson's disease, exercise can definitely help a lot. So what they do is they put those people with Parkinson's at let's say 40s on very professional exercise. Every day, they run for, let's say, 5 kilometers. They swim, or they do some different type of exercise. And no, this kind of therapy, then it could dramatically slow down the progress or progression of Parkinson's disease. Okay, if a person is pregnant with fibroids, what can be used? Sorry to ask questions. No, it's okay. Then it depends on the size of the fibroid. Because obviously, if that lady is pregnant when she is having a fibroid, that means the fibroid is not big enough to prevent the pregnancy. So it's okay. Observe it to see whether the fetus can grow healthily. If the fetus can grow healthily, then leave it alone until the lady give birth to the newborn baby. After that, normally in China, what we do is they keep a close eye on this condition. If the fetus grow healthily, they just leave it alone until when the lady delivers the newborn baby. Then at the same time, they take an operation. They take the fibroid out of the uterus, out of the womb. So actually, the lady doesn't suffer twice. So this is what we do in China. But if
When you use
the fibroid is big enough, sorry. Sorry. Please mute yourself. Make sure that you're muted. Otherwise, okay. Thank you. Let me go ahead with this fibroid. So, if the fibroid prevents the healthy growth of the fetus, then that's something totally out of, it's not beyond the Greenwood's health consultant's hands. So seek the medication of the doctor. Doctor will decide what to do. Okay, then would you be so kind as to send a copy? Oh, definitely. All these presentations are being recorded and the videos are uploaded into the youtube.com. You log into the youtube.com and search for Greenwood Official. So you'll find all the presentations, the Friday Zoom meetings, including the ones for Kenya, are there. So don't worry. We take the record and you can find the videos there. Okay, can malaria be killed? Definitely malaria can be killed with anti-malaria medicine, and we also have the Malapower capsule. So there are a lot of good anti-malaria medicines in African market. They all work very, very well. It definitely can be killed, but unfortunately, malaria is a disease that can come and goes because it doesn't develop the antibodies that really last in your body. So maybe after 1 year or several years, when your immune system is low, or when you are bitten by mosquitoes with great load of this malaria parasites, then you could suffer malaria again. And frequent repeated infections with the malaria that can cause the enlarged spleen and enlarged liver, very unfortunately, and the how to say, the dysfunction of the spleen and the liver. So be very careful once you suspect that you have malaria. You go to see a doctor immediately and take the anti-malaria medicine. Difference between nerves and arthritis. Nerves and arthritis. Nerves of nerve systems. Arthritis is a joint problem. So there's a big difference to me. Okay, let me answer another questions that's sent by Mr. Budiman. Somebody asked, this is from WeChat group. Somebody asked, swollen legs. So he said that, I have a client, I have a customer who has a swollen legs. So what could be the cause? Then I want to explain what diseases that can cause the swollen legs. Actually, swollen legs can be caused by either heart failure or kidney failure. Many heart diseases such as the coronary artery disease, hypertension, dysfunction of the valves, and the cardiomyopathy can lead to chronic heart failure. The cardiomyopathy actually is a disease of the heart muscle. Alcoholism and viral infection can cause the inflammation of the heart muscles. Eventually, the cavity of the heart is enlarged and stretched, compromising the ability of the heart pumping blood. The heart's inability to pump blood efficiently caused an increase in the pressure within the heart and the blood vessels. So this increased pressure forced the fluid out of the blood vessels and into the surrounding tissues. So leading to, and result in edema. So the lower extremities, especially the legs, particularly, the legs and ankles, a very common site for the fluid accumulation due to the effect of the gravity and the body's circulatory dynamics. So kidney disease swelling, medically known as edema, occurs when of kidneys cannot effectively remove the excess fluid from our body. Healthy kidneys filters waste and extra water from our blood, just like what Miss Linda June has presented. The filtering units of the kidneys remove the excessive electrolyte, the waste, the toxins, and the excess water, excess fluid. But once they are damaged, the whole process becomes impaired. And then the swelling happens because fluid that should be eliminated through the urine instead built up enough tissues. So this excess fluid accumulation is called the hypervolemia. And it is directly result of reduced kidney functions. So as kidney disease progresses, the kidneys lose the ability to maintain proper fluid balance, leading to more frequent and severe episodes of swelling. But how do we know whether these swollen legs are caused by heart failure or kidney failure without, the diagnosis? Definitely, it must be diagnosed by a doctor. But how do you know, as a, Greenwood health consultant? You observe, you know, the how to say the order of the swelling. What does it mean? Edema caused by heart failure typically develops from the bottom upwards. What does mean from the bottom to the upwards? First, you see the swollen legs and ankles, and gradually you see the swelling goes up and up until it goes to the other part of the skin, like the face. So it first starts from your feet, from your ankles, from the legs, and going upwards. So this is typically the swelling due to heart failure. Now let's talk about the edema due to kidney failure. It is just opposite direction. It first begins from the face and eyes, and then going down to your skins, to your hands, and then to your legs and feet and ankles. So the typical signs and symptoms is early in the morning. When you get up, you look at yourself, look at your face in the mirror. If you see that you have swollen eyelids, swollen faces, and then you realize that this could be caused by the kidney failure. But believe me, you can't wait until this. And you can't diagnose heart failure and kidney failure only by the part of your body which are swollen. So eventually you must see a doctor. So normally the doctors give you a checkup. The doctor give you the blood test and the urine test. So in this case, you advise your customer to go to a hospital and have a checkup. First, they're going to give the echocardiography. It means that, they use the machine to look at the shape of your heart and your blood vessels to see whether the heart is enlarged and what caused the problem. And definitely they're going to take the urine test to see whether there's a protein in urine. We just explained that, the filtering unit of the kidney are responsible of recollecting the albumin, the good stuff to your body and eliminate the excessive electrolytes and the toxins and the waste and the waters. So the proteins, too much proteins in the urine. This is a first indication of the urine of the kidney dysfunction. And also, you're going to undergo blood test, especially, there different, the estimated glomerular filtration rate, and also the blood serum creatinine, and also the blood urea nitrogen, the BUN. So with the abnormal indicators of this blood test, the doctors may know that your kidneys are suffering from the dysfunction. So I think, I answered your question. Yes, swollen, but there's another type of disease can cause the swollen legs. Actually, it is another type of diseases. I don't know whether you have heard of elephantiasis. Elephantiasis means that, there's this is a disease that's spread by mosquito bites. There's another type of parasites that, can be spread by mosquito bites. So if the mosquito bites you, the mosquito carries this parasite, and it will inject this parasite into your bloodstream, and this parasite will circulate in your bloodstream and multiply themselves and block the lymphatic system. Actually, lymphatic system first collects the lymphatic fluid, and send them to the main bloodstream. So in this way, the lymphatic system, the lymphatic vessels are blocked. So, by doing this, your skins, your soft tissues, a lack of blood supply and nutrient supply. So then gradually you have swollen legs. But this kind of swollen legs is different from the swollen legs caused by the heart failure or kidney failure, because the skin get thickened. That's why we call it the elephantiasis. It's like the elephant skin. In Africa, we all see the elephant. They have very thick skins, rough, thick skins. So, this kind of swollen is different. Yes, it is swollen, but it doesn't like the swollen caused by the heart failure or the kidney failure. That kind of swollen is almost, how to say, clear, transparent. You know, you press it, it makes a dent. But this kind of elephantiasis, when you press it, it doesn't actually get a dent, and you can observe the skin also get damaged. So this can help you also understand, what could cause by, what could cause this kind of swollen legs. And definitely to diagnose this disease is simple. You go do a blood test, the doctor will put a drop of your blood under the microscope. So if you see the parasites, they will know that this is caused by the parasitic infections, and this is the elephantiasis. So different kind of swollen, they have different indications that can tell you which is which. So I hope I answered this question. Yeah, somebody call it elephantitis. Talking about elephantitis, madam, what can we give to the client? To be very, very frank, there's no specific, because once the lymphatic vessels are being blocked, totally, it's not going to be reopened. So you can give the blood thinners, the product that improve the blood supply, like the ginkgo biloba, like the deep sea fish oil, like the chitosan, which works as blood thinners. But to be very frank, it doesn't really reopen those clogged lymphatic system. So also this is need some sort of surgery. Well, you can recommend the products, but the products cannot totally reverse the whole procedure. the whole process. Sorry for that. Okay, what can we give for, yeah, the same, answer the same questions. You can recommend those products, blood thinners, products that improve the blood circulation, but to reopen those blocked or clogged lymphatic vessels, they need maybe the surgery. Okay, so any more questions? If there's no questions, we would end today's presentation. What can I recommend for epilepsy? Epilepsy is a kind of neuron diseases that so far we couldn't understand the clear cause of the epilepsy. But sometimes, we know that this is due to some of the urines gives off the abnormal electric pulse because, of neuron system of neurons send off the electric pulse every second, millions of them, but sometimes, the electric pulse is, abnormally sent and, triggered. So this is what we could understand. So products that can nourish of neuron system, like the deep sea fish oil, omega-3, omega-369, lecithin, blueberry products, ginkgo biloba, those products can help. But still, these products won't be able to completely stop. It only makes the epilepsy occur less frequently. For example, we know that some children suffers from teenagers, they suffer from epilepsy even more often than adults. So maybe before you give the products, it occurs every once in a month or twice in a month. But after you recommending the products, after taking the products, they may suffer from it less frequently. This that we can, we observe this from the market, but it cannot completely stop it. So still, they need proper professional medication and sometimes surgery, brain surgery that if the doctors know, neurologist, those doctors that specialize in neurology knows that which part of the brain that can trigger this, they could use some of the electric, shock to block that path or to reduce this. So they still need very professional treatment. But definitely you can recommend the neuron nourish products. Okay, any more questions? What products is appropriate for if there's a protein in urine? I think, Madam Linda has just presented us kidney tonifying for women, also cordyceps and chitosan. They can also work for this, but definitely you need to recommend your customers to have a checkup. What exactly causes the protein in urine? Protein in urine is a consequence. It means the damage of the filtering units of the kidney. But what caused it? You got to help them to identify the causes and remove the causes. Otherwise, if the causes are still there, you give the products that won't really help them. So recommend them to see a doctor and have checkup to understand the root cause of the protein in urine. Which products are good for person who has gallstone? Okay, gallstone means that the metabolism of the liver is somehow disrupt or disturbed. So first of all, watch your diet, control your body weight, and watch your diet, eating balanced diet, and then you got to take products that benefits your liver. So we have Livergen, we have HepatSure, and we have the lecithin. Lecithin is extremely important for liver health, and also omega-3 deep sea fish oil So those products are excellent, excellent for liver. So if the gallstone is big enough, if the doctor says that person needs a surgery, then go for a surgery. If the doctor doesn't suggest a surgery, you got to take the products to help you to, metabolize the cholesterol, metabolize the bile salt. That's the most important components of the gallstone. So what products can be given to a 2 years baby suffering? Oh, sorry. Then for 2 years baby, the normally greenwood products are not recommended for 2 years. All our products, even the blueberry super nutrition blueberry juice, we recommend it at least 5 years, 6 years and above. So for 2 year baby, you got to see pediatricians. Means that's the doctors that specialize in treatment of children. What are products for headaches? What cause the headaches? So, fever causes headaches, stroke causes headaches, lack of blood supply, sometimes even the fatigue, uh, eye strain can also cause the headaches. So you got to understand the causes of the headaches and, remove the root cause. So if you don't know, you just have a common headaches. So make sure that you are well hydrated, drink plenty of water because dehydration can directly cause the headache. To take 2 liters of water fluid every day, and you can drink of tea. You can drink of cooling class tea, or pine pollen tea. Those teas can help. And also you can take the products that benefits of brain. I mentioned the deep sea fish oil, the lecithin that can also help. Okay, so any more questions? Oh, for fatty liver disease, number one, exercise. Number two, watch your diet. Eat balanced diet that rich in dietary fiber, less salt, less sugar. Completely cut the added sugar, like the white sugar, the soda drinks, the cakes, highly processed food. Completely remove those and cut consumption of those food. Eat healthily, and then you can definitely take Herbature, lecithin, deep sea fish oil, which is rich in omega-3 to help the fat metabolism in your liver. Okay, what else? So if there's no questions, we can see good day and good night, and we say goodbye to you. So ladies and gentlemen, let's unmute yourself and say thank you to the two beautiful ladies, Miss Linda and also Miss Michelle. And
Thank you very
also,
much.
Thank you.
Thank you.
Thank
Thank you
you.
very much.
Thank you.
Thank you,
Good
Mom
night.
Michelle.
Thank you.
Thank
Thank you,
you.
Mom Linda.
Thank
Good night, everyone. Take care.
Good
Thank you,
night.
everyone. Bye-bye.